Physical Activity Part 1. Humans were designed for movement. However, we have become more sedentary over the past 5 decades due to the use of labor-saving devices and other technologies. Physical inactivity is a risk factor for chronic diseases such as heart disease, obesity, diabetes, and osteoporosis. Physical activity is important to good health. Becoming physically fit requires a lifelong commitment of time and effort. And being physically active must become as natural as bathing and brushing your teeth on a regular basis. The good news is that we do not have to be competitive athletes to achieve significant health benefits. We can improve the quality of our lives by getting regular amounts of physical activity. So let's look at the benefits of physical activity. Increase in basal metabolic rate or BMR, increase muscle mass, decrease in body fat, greater bone density, improve circulation, heart capacity, and lung function, reduce risk of heart disease, improve blood lipid profile, decrease blood pressure, slow resting pulse rate, improve glucose tolerance, reduce menstrual cramps, boost the immune system, and increase self-esteem and body image. Research studies show a strong relationship between fitness and academic achievement in children. Specifically, regular physical activity may positively impact reading and math scores. The physical activity guidelines. Children and adolescents need 60 minutes or more daily. Most of this should be moderate to vigorous intensity aerobic activity, muscle strengthening activity at least 3 days a week, bone strengthening activity at least 3 days a week. And the activities should be age appropriate. For substantial health benefits, adults should get at least 150 minutes a week of moderate intensity or 75 minutes a week of vigorous intensity aerobic physical activity, or an equivalent combination of moderate and vigorous intensity aerobic activity. For additional and more extensive health benefits, adults should increase aerobic physical activity to 300 minutes a week of moderate intensity, 150 minutes a week of vigorous intensity aerobic physical activity, or an equivalent combination of moderate and vigorous intensity activity. Adults also should include bone and muscle strengthening activities on all major muscle groups on 2 or more days a week. Healthy pregnant women should follow the adult guidelines. The risk of moderate intensity activity during a normal healthy pregnancy are very low and do not increase risk of low birth weight, preterm delivery, or miscarriage. In fact, it may reduce the risk of pregnancy complications such as preeclampsia and gestational diabetes. We recommend using common sense, especially when you get to things like cycling or step aerobics or other activities such as jogging, which may increase the risk for falls. Regular physical activity continues to benefit a woman's overall health after giving birth. Moderate intensity physical activity during the postpartum period increases a woman's cardiorespiratory fitness, improves moods, and helps to achieve and maintain a healthy weight. When older adults cannot meet the adult guidelines, they should be as physically active as their abilities and conditions allow. They should do exercises that maintain or improve balance if they are at risk of falling. Individuals with physical and mental disabilities who are able to should follow the age-appropriate guidelines previously discussed. Research shows that regular physical activity provides important health benefits for individuals with disabilities, such as improved cardiovascular and muscle fitness, improved mental health, and better ability to do tasks of daily living. For overweight and obese individuals who need to lose substantial weight, more than 5% of body weight, 100 to 300 minutes per week of moderate intensity physical activity, 75 to 150 minutes per week of vigorous intensity physical activity. An equivalent combination of the two is recommended, understanding that if someone is substantially overweight, these are the ideal goals to eventually achieve. Start off slow and do something you love. To prevent substantial weight gain over 6 months or longer, we recommend 300 or more minutes a week of moderate intensity, 150 minutes a week of vigorous intensity aerobic activity, and an equivalent combination of the two. I should point out here, these are for preventing weight regain. Remember that people who lose weight often regain it after a short period of time. And so physical activity needs to be an important component to prevent regaining weight loss. Physical fitness program. The components of a physical fitness program should include all of these types of activities: cardiovascular endurance, muscular endurance, muscular strength, flexibility, posture and balance, and body composition. Cardiovascular endurance is the ability of the heart, lung, and blood vessels to deliver oxygen for muscular work. Oxygen is needed to burn fats and carbohydrates for energy in aerobic activities such as jogging, cycling, and swimming. Aerobic activities use large muscle groups for an extended period of time. Muscular strength is the maximal force that is exerted by a muscle or muscle group in a single contraction. It is developed by progressive resistance by weight training with weights, machines, and other resistance equipment. These are anaerobic activities or brief activities that rely on blood glucose to generate power. Muscular endurance is repeated muscular force that involves repetitions against resistance that are less than maximal. Muscular endurance exercises include anaerobic activities such as push-ups, sit-ups, and repeated lifting of light weights. Flexibility is the ability of a joint to go through a range of motion. Flexibility exercises include yoga and stretching activities. Flexibility exercises should be part of the warm-up and cool-down routine. Posture is the position in which you hold your body upright against gravity while standing, sitting, or lying down. Good posture involves training your body to be in positions where the least strain is placed on supporting muscles and ligaments during movement or weight-bearing activities. Proper posture keeps the spine, bones, and joints in the correct alignment, helps decrease the abnormal wearing of joints, decreases stress on ligaments, and prevents fatigue, backache, and muscular pain, and contributes to a good appearance. Balance training can help prevent falls, fractures, and other injuries. Balance skills deteriorate with age, so it is important to maintain these skills throughout our lives. Balance exercises should be done daily. And balance exercises include yoga, Pilates, and Tai Chi. Body composition refers to the proportion of lean body weight to fat tissues. Lean body weight is composed of muscles, bones, and organs. The average American has 16 to 24% body fat. The following chart shows the body fat percentage and classification for males and females.